Hello, good morning once again. My name, as usual, is Dr. Yakub from Life Hospital, Abuja. In the series of our health talks today, we'll be talking about breastfeeding. Well, the question is, why breastfeeding? The answer is, we see that the culture of breastfeeding seems to be fading gradually over time because somehow there is this general misconception that formula feeds or breast milk substitutes generally are more modern or better somehow as compared to breastfeeding. But we know generally that for the human beings, for the baby, of course, breast milk still remains the best. God in his wisdom made sure that every animal he creates, he knows its requirements and therefore has put in place for its offsprings what feeds will be the best and most appropriate. And so in this regard, breast milk for humans, it's certainly the best. And of course, mankind has attempted to formulate or to transform other forms of milk to be similar, to become close to breast milk, but so far that has not been successful. So up until today, as we speak with you, breast milk still remains the best feed for the baby. So because of this, we want to talk about it and then perhaps highlight the benefits of breast milk or breastfeeding, and then look at both the short-term and long-term benefits to the baby, and perhaps some of the disadvantages of the alternative feeds, which is the breast milk formulas. Then perhaps we'll touch a bit about weaning processes, that is weaning practices, because we also see that a lot of women don't seem to practice it appropriately, to the extent that at the point of weaning, you see that both the mother and the baby suffer, which shouldn't be. So we're going to talk about this, and hopefully at the end of the day, we should understand the process and then understand the benefits of breast milk. Now, breast milk, in this case, we'll be comparing breast milk and perhaps cow milk. Let me call it cow milk. Now, for the purpose of discouraging the use of breast milk formulas in whatever form, I'm going to be calling it cow milk. The whole idea is to drive home the fact that cow milk can never be compared with human breast milk in whatever form it comes. So I'm going to be referring to the breast milk substitute formula as cow milk in this video, just so that we drive home that point in order to discourage its use. So cow milk as compared to breast milk is not comparable in terms of benefits to the baby. Now, looking at breast milk, by the way, the woman also benefits from breastfeeding. So we're going to be talking about that as we go along. But what are the first direct and immediate benefits of breast milk to the baby? The first thing is, of course, nutrition. In breast milk, God has put in almost every nutrient that the baby needs for his or her survival, especially within the first few years of life up until year 2. So when we talk about human nutrition, we look at 5 major nutrients that human being require, or babies requires, needs rather, for growth and development. And these nutrients includes proteins, carbohydrates, fats and oils, vitamins and minerals, and then water. And breast milk contains all of this. Because as far as human nutrition is concerned, breast milk contains every nutrient that the baby needs. So when you're breastfeeding, be rest assured that everything that baby needs as far as for his growth and development is in breast milk. So you don't need to add any other thing, including water, especially in the first 6 months of life. Now, in addition to that, breast milk also contains some antibodies, that is immune protective substances. Now, the pregnant woman lives in an environment where she is exposed to different kinds of organisms. Usually, the pregnant woman develops immunity or antibodies to these organisms, viruses, bacteria, and in fact, in this case, even malaria. So these antibodies or these protective chemicals are passed on to the baby through breastfeeding. And so the baby also benefits from the antibodies that are present in the breast milk, such that in most cases for breastfeed, especially infants who are exclusively breastfed in the first 6 months of life, they tend to fall ill less frequently because they have antibodies or chemicals that protect them from diseases that are common in the environment where the mother lives. So at least for the first 6 months of life. So in addition to nutrition, baby is also protected. As far as immunity is concerned, usually the infant, the baby child, does not have developed immunity at the time of birth, and or his or her system only gets to develop this immunity or resistance to infection in his or her environment as he or she grows and gets exposed to some of these organisms. So in the interim, while his own or her own immune system develops, the mother protects him or her from the first from birth to the 6 months of life, when his or her own immune system would have developed. So this is one very important benefit of breast milk, which is not in formula or cow milk. And so babies who are not breastfed don't have this advantage, and that is why the more formula or the more cow milk you give the baby, especially where you're not breastfeeding as a mother, the more likely that the baby will get sick every now and then. So there's an advantage of that as well as far as immunity is concerned. Now, in breast milk, of course, is still cheaper. Now, these are advantages to the mother and maybe the couple or the parents, as it were. Breast milk obviously is cheaper, and especially in these days, in these times, things are quite hard for everyone, and so everyone naturally will want the easy way out of the circumstances of life. And God has put this for us such that you don't need to spend money when you breastfeed your baby, because you don't need anything. It is cheap. All that the mother needs to do is to eat her regular meals and make sure that she takes a balanced diet, and so therefore she passes on this nutrition to her baby. So it's cheaper. Now, women who also breastfeed tend to have less incidences or incidence of breast and ovarian cancer late in life, and that has been shown in scientific research and all of that. So the woman also benefits rather from breastfeeding. The other advantage, of course, is if you're breastfeeding as a woman, there's a chance that because you're passing on some of the nutrients you take, so of course it may also to some extent help you in weight, to prevent excessive weight gain, because to some extent some of the nutrients you take, instead of storing them in you, you're passing some of them to your baby. So there's a whole lot. By the way, in the first few weeks of birth, one of the things that happens to every woman who has delivered, whether vaginally or through cesarean delivery, is the fact that there's some degree of bleeding from the genital tract. Now, when you breastfeed as a woman, the breastfeeding process helps to contract the womb of the woman to the extent that bleeding is minimized. And so the woman also, in the first few weeks of birth, when you breastfeed, you also benefit from reduction in bleeding. And of course, that in itself is also helpful in the general health of the woman. And so in the long term, children who are, especially those who had or benefited from exclusive breastfeeding in the first few months of life, especially 6 months, seem to have less risk of childhood and adult obesity later in life, and therefore they have less risk of developing diabetes and issues related to cardiovascular diseases much later, especially things related to obesity. So babies who are exclusively breastfed or who are not given formula usually have these benefits much more than those who had cow milk during their infancy. So you see, for both in the both short term and long term, you see that there's a whole lot of benefits that the baby as well as the mother gets from breastfeeding. So if you compare this with cow milk, as I will call it, the much it gives, it's the reverse of everything I've talked about as benefits of breastfeeding. First, the nutrients are not wholesome, as it were, because if you compare human milk and cow milk in terms of constitutions of some of these nutrients, is either you have something too much for the human consumption that tends to set the path of disease in this baby along the line. And so if you know that what you are doing, if you are giving your baby formula or cow milk and you know that you are setting him up for disaster later in life, I'm sure most mothers will not want to do that. And so it is important to note that, and until it is absolutely impossible or breastfeeding is difficult or it's not available, as it were, that is the only time we will advise that a woman gives her baby cow milk, as it were. In whatever forms it comes, it is still cow milk. And so if it is not possible for whatever reasons, either as a result of disease conditions or sometimes as a result of demise of the mother, unfortunate demise of the mother at the time of birth, or for whatever reason that it is impossible to breastfeed or breast milk is not available, then of course you cannot starve the child, so you want to give cow milk. But in that case, we know that of course the child in question is not necessarily getting the best. So how are we supposed to breastfeed? Well, the recommendation is that the first 6 months of life, the baby should be exclusively breastfed to the extent that there shouldn't be even water. The baby should not be given, because breast milk has more than enough water for the baby. And as I said in the beginning, every other nutrient is also available for the baby in the breast milk. So the baby does not need anything for the first 6 months of life. How often are we supposed to breastfeed? It should be on demand. A baby should not have a meal timetable where, at some hours, 2-3 times a day, we want to feed. No, that's not the recommendation. We also have to remember that when we exclusively breastfeed, the breast milk serves as baby's water when he is thirsty, and sometimes actually the breast milk serves to even pacify the baby when he or she is in some kind of discomfort. And so sometimes when the baby cries, it may not just be hunger, it may be thirst, it may be discomfort. And when you give breast milk, it serves, and usually serves the purpose. So breastfeeding should be on demand. Anytime the baby needs the breast milk, we should give. And that is why it's actually a 24/7 job. There is nothing like, I fed him 30 minutes ago, I want to rest and all of that. And that's why it is necessary that women who have given birth should prepare themselves mentally to breastfeed, because it is really demanding. But one good thing is that it is very rewarding for women who are able to achieve it. So the first 6 months of life, the recommendation is that we do exclusive breastfeeding. Thereafter, you can add complementary feeds. Now here we see in practice women getting confused about this. Now complementary feed in this case does not mean cow milk or breast milk substitutes like infant formulas. No, as long as the baby is on breast milk, you don't need to add in any form of infant formula for the baby, because again, when you do this, you're probably counseling the beneficial effect or the risk, or adding to the risk of formula feed to the baby while you're breastfeeding. So after 6 months, what is required for the baby is actually additional or complementary feeds in form of energy, things that will give the baby a lot more energy for the growth and development at that time, because usually around 6 months the baby begins to crawl, the baby begins to do other things that will require energy much more than what is present or available in breast milk. So at this point you can add cereals commonly. That's what most mothers do, but it mustn't be cereals. Home foods in the form that the baby can tolerate can be formulated in any way that is available to the parent. So different formulae is available for in different circumstances depending on what you can afford as a mother or as parent. So it mustn't be some form of cereals that is expensive that you can't afford. Formally, there are different forms, feeds that can be produced, especially from locally available things around you. If you want details of that, you can contact your doctors or health caregivers, nurses. They can help you to formulate some of these meals or feeds that can complement breast milk after or beyond 6 months. Usually you do this, and as the baby tolerates the complementary feeds, you'll be increasing as the need demand. Of course, as baby grows, there will be need for increasing feed. So breast milk, however, still remains the major meal for the baby. Now, how long should we breastfeed? Medical recommendation is 2 years. But what we see happening these days is that most mothers get tired of breastfeeding at about 1 year of age. In fact, it looks as if it's now becoming a fashion that babies are presented with the birthday gift of weaning at the time of 1 year birthday celebration. We hear it commonly among women. They tell you, I weaned this baby because he's 1 year, as if it's a formula now. But it's wrong actually. So we advise women to, as much as possible, continue breastfeeding alongside with complementary feeds, home feed in whatever form the baby can tolerate, up until 2 years, beyond which, of course, weaning should take place. That is medical recommendation. Situations arise, however, where a baby refuses to take breast at some point, sometimes even before 6 months. I've seen patients or mothers who complain that the babies refuse to take their breast milk few months after birth, and as long as the mother can try and the baby does not accept breast milk, of course there's nothing you can do. So if that happens, then if the child is below 1 year and he or she refuses breast milk, then of course cow milk or breast milk substitutes in whatever form that is available will be the only major feed for the baby. So that is the only condition, of course, where you would say that yes, indeed, since the baby refused, for whatever reasons, refused to take breast milk, then of course you would want to give formula. You won't say because the baby is not taking breast milk, you want to starve him or her. And so you will need to do that when the baby refuses breast milk. Now, where the baby or some does not tolerate breast milk, there are babies who have lactose, in what we call lactose intolerance, and so there are other formulae where the lactose is removed and you can give such beyond breast milk. Now, if you breastfeed appropriately, as we say, up until 2 years as recommended, or if at any point for some reasons you want to wean your child before 2 years, it is not advised that you stop breastfeeding suddenly. If you do that, in most cases, both you and your baby will suffer, because when you stop breastfeeding suddenly, maybe at the time you stop, baby is not actually, breast milk is his or her main meal, and if you remove that and baby refuses to take other things, baby stands the risk of malnutrition. And we see it happening sometimes where the baby is weaned off breast milk and the baby refuses to take every other thing, and then the baby's health goes down because of malnutrition. So it is advised that you don't stop breastfeeding suddenly. The disadvantage that confers on the woman also is that If you stop breastfeeding suddenly, usually there's this breast engorgement that occurs, and you see women struggling with it. So the weaning process, weaning itself is supposed to be a process over a period of time. It could take weeks, it could take months. But what is advised is that from the moment you make up your mind to wean your baby, make sure that you start gradually by reducing the number of feeds, that is breastfeeding, you give in a day. If you perhaps were giving 10 times in the day, you can reduce this to 9 over a period of 1 week, reduce it to 8 the next week, reduce this to 7, like that, up until when the baby forgets breast milk. Of course, you know that while you are doing this, you are also along the same line complementing and adding the other feeds that the baby will tolerate, and make sure that whatever it is you're giving your baby after that, it's balanced nutrition, balanced diet. So if you do this over a period of time, the baby does not suffer as much, because ultimately he or she will just forget breastfeeding. You yourself don't suffer the breast engorgement that comes with sudden weaning process. So you find out that both you and your baby are able to tolerate the weaning, and so at the end of the day, everybody gains and nobody suffers. So in summary, I want to emphasize the need for our mothers to breastfeed their infants. It's very important to know this, that the way God created us, I think humans are the most advanced and developed creation of God, and I don't think it is appropriate that we reduce ourselves to animal level and believe that human nutrition, especially our infant nutrition, should be based on animal milk rather than human milk that God has given us free of charge. So we hope that mothers will get some education from this, and we hope that this will encourage women to breastfeed their babies up until when it is recommended for it to be stopped. Thank you very much.